Welcome to MitoCast by Mito Foundation. We share information and resources to support people with Mito, their families, and the wider community. All content is created by Mito Foundation. AI text-to-voice technology is used only for the production to make our resources easier for everyone to access.
So today we're diving into a really important conversation. How to navigate the health system and build a care team when you or someone you love is living with mitochondrial disease, or we call it Mito for short.
It's a big topic, and it's something that looks different for everyone because Mito can affect people at all stages of life and in many different ways. Some of you listening may already have a confirmed diagnosis for yourself or a child. Others might be on the path of trying to get answers. Wherever you are in that journey, what we're talking about today is designed to give you clarity and confidence to help you manage your health.
Exactly, because the health system can feel complicated and sometimes overwhelming, especially when you're already dealing with the uncertainty of Mito. But the reassuring thing is that you don't have to do it alone. Building a care team around you can make it easier to manage the complexity. And today we'll explore what that can look like, how to access services, and how to keep everything coordinated.
Let's start with what we mean when we say care team.
At its simplest, a care team is the group of professionals who work with you to look after your health. For Mito, care often starts with a specialist, commonly a neurologist, a metabolic physician, or, for children, a paediatrician. Many of these specialists combine their clinical work with genetics, helping to connect the dots between symptoms, test results, and family history. These are the people who have developed expertise in Mito. They're often referred to as Mito specialists. They're not a separate profession, but health professionals who've built extra knowledge and experience in this condition.
That's a good point, because sometimes the term Mito specialist can be confusing.
It can. There isn't a single qualification that makes someone a Mito specialist. Instead, it's usually a doctor trained in one of those key areas: neurology, metabolic medicine, pediatrics, or genetics, who has gone on to focus their clinical work on Mito. And because Mito can affect so many different organs and systems, the care team often grows. Doctors in general tend to specialize in certain areas of the body. So while every doctor has an understanding of the whole body, each one has deep knowledge in their particular field. That's why there isn't one doctor who can manage everything. Instead, you may see different specialists working together, each bringing their own expertise. For example, you might see a cardiologist if your heart is affected. That could include problems like arrhythmias, palpitations, or changes in heart function. You might be referred to an endocrinologist if Mito is impacting things like blood sugar, puberty, growth, or thyroid function. Or you could be referred to an ophthalmologist if you're experiencing changes in your vision, like difficulty focusing, drooping eyelids, or vision loss.
Right, and each of these specialists has their own area of deep expertise.
That's right. A cardiologist knows the heart inside and out. An endocrinologist has the training to understand hormones and how they regulate so many parts of the body. An ophthalmologist focuses just on the eyes and vision, so together they build a clearer picture of how Mito is affecting you.
The important thing is that all these people ideally work together, sharing information and planning your care in a coordinated way.
Yes, that's what's called multidisciplinary care. Different professionals with complementary skills collaborating, not just with each other, but with you and your family.
It means your care isn't happening in little disconnected pieces, but instead is connected. And that's especially important in Mito because it's rarely just one part of the body that's affected. And a care team isn't fixed, is it?
Not at all. It changes as your needs change. When a diagnosis is still being explored, you might spend more time with a neurologist or genetics team. Later, if fatigue or mobility become a challenge, you might see a physiotherapist more often. For children, a developmental paediatrician might become important if there are concerns around learning, development, or behavior. It's not about having one set team forever. It shifts depending on your age, stage, and what's happening day to day. And when you step back and look at all those moving parts, there's usually one person who helps bring it all together. The central figure in keeping all this organized is often the GP, or sometimes the mito specialists themselves. What matters most is having someone who can act as the main coordinator, the person who sees the whole picture and helps keep everything and everyone connected.
That point about coordination really matters. For children, is it the paediatrician who steps into that role?
Yes, and that's a really important role. Paediatricians are not just children's doctors. They're specialists who've trained for years to understand medical, developmental, and behavioral issues in children. They often keep seeing a child right through to 18, which means they can build long-term relationships with families. That trust is key when a child's condition is complex. Paediatricians are often the ones who pull together reports from schools, developmental assessments, and allied health professionals, and use that information to coordinate care.
So they're not only treating medical symptoms, but they're also making sure everything links up: school support, therapy, development, and healthcare.
Exactly.
Now, it makes sense to move on to genetics here because for many families, it's the starting point. The genetic team is often the one helping to piece things together.
Genetic health professionals play a central role in Mito. Genetic counselors and clinical geneticists don't just help confirm a diagnosis. They also explain what it means for you and your family. They can talk you through inheritance patterns, reproductive options, and the possible outcomes of testing. And they're there to support you emotionally because these conversations often touch on really personal and sometimes difficult decisions.
So how do you actually get to see one?
Genetic testing usually requires a specialist referral. It's not something a general practitioner will routinely order. If you're an adult, your GP can refer you to a neurologist or metabolic physician, and from there, that specialist may refer you to genetics. For children, it often starts with the paediatrician, who then connects families with a clinical genetics service.
That referral step is important because it means the genetics team gets all the relevant information up front.
Exactly. And eligibility for publicly funded testing varies between states, so a genetics team can explain what's available, where you live, whether there may be costs, and which tests are most appropriate. They're also across the latest research and technology, which is important because testing for Mito is advancing quickly.
It's also important to know that results can take time, often several months, sometimes longer, if the test reveals a genetic change that isn't yet clearly linked to Mito. Waiting is tough, but knowing that it's part of the process can help.
And even when results come back, sometimes they're uncertain. A change in the DNA might be found, but it isn't yet clear whether that's causing Mito. In those situations, genetic counselors help families make sense of the uncertainty. In our next episode, we unpack genetics and Mito. Make sure you follow the channel so you don't miss it.
So once you have a diagnosis or even a strong clinical diagnosis, the focus turns to management. That's where Mito clinics come in.
Mito clinics are specialist centers that bring together neurologists, metabolic physicians, geneticists, nurses, and allied health professionals. Their role is to provide diagnosis, management, and ongoing monitoring all in one place. Some focus on children, others on adults, and some offer both. They're designed so that instead of seeing different people in lots of different locations, you can have coordinated care under one roof.
On our last count, there were around 15 Mito clinics nationally, most located in major cities. That number can change, of course, but it gives you a sense of the network that exists.
And it's worth mentioning referrals here too. To attend a mito clinic, you'll usually need a referral from your GP or a specialist. Having that referral in place ensures the clinic receives your history and can plan the right assessments.
If you've recently moved to a new area or you're at the stage of considering mito as a possible diagnosis, you can find a list of all mito clinics on our website. The clinics directory outlines where the clinics are, whether they see adults or children, and what services they offer. That way you can plan ahead, know what's available, and ask for the right referrals. We've included the link to the directory in the show notes so you can easily find and explore it when you're ready.
Also, Australia is huge, and not everyone lives close to a mito clinic. If you're in a regional or remote area, getting there might involve a long travel. Some clinics now offer telehealth for at least some appointments, which means you can connect with specialists without always needing to make the trip. It's not a complete replacement for in-person care, but it makes expert advice more accessible.
We also have the Mito Professionals Directory for when you're looking for individual health professionals who know about Mito. The directory includes doctors and allied health providers with experience in Mito. You can access it by contacting the helpline on 1300-977-180. The team can help you find someone local, or as close as possible, who understands Mito and can be part of your care team. Having professionals who already know the condition can make a huge difference in your experience of care.
I'm interested. How do health professionals actually get added to that directory?
There are a few different ways. Some nominate themselves, some are recommended by people in the Mito community, some connect with us through other professional networks, and others are invited directly by the Foundation. It's this mix of approaches that helps create a trusted list of health professionals with experience in Mito, so families can feel confident when reaching out for support. Now let's talk more about allied health professionals, because they're often the ones people see most regularly.
Allied health is a broad term. As Allied Health Professions Australia explains, it covers university-trained health professionals who aren't doctors, dentists, or nurses, but who bring specialized expertise in areas like movement, nutrition, communication, or emotional well-being. They usually work as part of a multidisciplinary team, giving practical, hands-on support alongside your medical care.
For people with Mito, allied health is often central. While your GP or specialist might guide diagnosis and medical management, allied health professionals help with the day-to-day challenges of Mito.
Access usually starts with a referral. For adults, that might be through your GP as part of a chronic disease management plan, which can unlock Medicare subsidized sessions. For children, it could be the paediatrician who brings allied health into the team. In some cases, you can self-refer, but funding support through Medicare usually requires a formal referral.
Can you give me an example of what some allied health professionals do?
Sure, physiotherapists are experts in movement and the structure of the body. For someone with Mito, they can help with gentle exercises to maintain strength, flexibility, and energy. They focus on safe strategies that reduce pain and prevent overexertion, always adapting to your body's needs. Occupational therapists are another key support. They focus on your everyday life, making sure you can keep doing the activities that matter to you. That might mean suggesting ways to conserve energy, recommending equipment, or adapting your environment so tasks are easier and less draining. Dietitians are key when it comes to energy and nutrition. Food and diet directly impact how someone with Mito feels day to day. A dietitian can create a plan that supports your health, fits your lifestyle, and adapts as your condition changes. And then there are psychologists and social workers. Living with a rare condition like Mito can be emotionally demanding. Psychologists can support your mental health, provide coping strategies, and help with issues like anxiety or depression. Social workers can help you navigate complex systems like the NDIS and access financial or community support. Both can also support the people who care for someone with Mito.
Not everyone will need every type of professional, but knowing they exist gives you options if and when you need them.
With all these different people potentially involved, coordination becomes really important.
Many people find it helpful to keep a health folder or use an app where they store reports, results, and notes. That way, you don't have to rely on memory for appointments.
Australia also has My Health Record, a digital health record system that allows information to be shared across providers. It's not perfect, but it can reduce duplication and make sure everyone has the same picture of your health. You can set it up through your MyGov account using your Medicare details. Once active, you can check what's uploaded, add your own notes, and choose which providers can see it.
That's helpful. So beyond My Health Record, there are also systems that GPs or paediatricians can put in place to keep care more structured, right?
Yes, for adults, your GP is usually the one who can set up something called a chronic disease management plan, funded by Medicare. These are designed for people with long-term conditions like Mito. They outline a structured approach to care, involve input from multiple professionals, and provide access to Medicare-subsidized allied health visits. It's one way of making care more affordable and coordinated.
Okay, and what about for children? How does that coordination look different when a paediatrician is leading the way?
Pediatricians often take on a similar role. They might draw together reports from speech therapy, physiotherapy, schools, and developmental assessments, making sure the big picture is visible and shared. That coordination is just as important as the actual appointments, because it keeps the system manageable for families.
Another simple but powerful idea comes from the Better Health channel. Write down your care team members and what they do, and give each of them a copy. That way, everyone knows who's involved, and communication is smoother. Keeping a notebook for your own questions and answers is another practical strategy.
And alongside professional support, it's worth remembering that everyday management plays a part too. Things like eating well, getting enough rest, taking prescribed medicines, and having regular check-ins with your GP or pediatrician all help in keeping Mito as stable as possible.
All this links back to your healthcare rights, doesn't it?
Definitely. You have the right to be informed, to ask questions, and to be actively involved in decisions about your care. You have the right to consent, or not consent, to treatment. You also have the right to involve family or carers in planning. Good care is about partnership, and that means open communication.
And you have the right to a second opinion. This is especially relevant with complex conditions. A second opinion can confirm the path you're on or open up new options. Most professionals respect this because they want you to feel confident in your plan. It may take time to arrange, but it can provide valuable reassurance or perspective.
And your healthcare rights in practice may mean asking your cardiologist to copy in your Mito specialist after an appointment, or making sure your pediatrician has a copy of your child's speech therapy plan. Rights aren't just abstract. They're tools you can use to make sure care is joined up.
Another tool that can support safety, especially in hospitals, is something called a clinical alert.
Clinical alerts are warnings linked to your hospital medical record that let staff know there's something important they need to be aware of. An alert doesn't show all the details straight away, but it signals to doctors, nurses, and other staff that they should check your record for extra information. For example, a clinical alert might flag a serious allergy, like a reaction to certain medicines, or it might note a health condition that requires special care, like Mito. In some hospitals, the alert also shows up on a patient's wristband or chart, so staff are prompted to review it before treatment.
This system is really about safety and consistency. Hospital teams change shift by shift, and not every doctor or nurse will know your full history. A clinical alert helps make sure the most important things aren't overlooked, even if you're being seen by someone new.
If you think this could be helpful, you can ask your doctor, nurse, or the hospital's medical records team about adding one. They may request a letter from your specialist to confirm what needs to be included. It's also worth checking if alerts carry over when you attend a different hospital, because processes vary.
For families, especially if a child is admitted regularly, this can be a real reassurance. Knowing that every time care is provided, staff are prompted to take Mito into account.
And if you're ever unsure about where to start with referrals, second opinions, or systems like clinical alerts, remember that our helpline is there to support you. We can help guide you through the options and connect you with resources.
Now let's talk about rural and remote care, because many people don't live near a major hospital or clinic.
Accessing care outside cities can be more challenging, but there are supports. Primary health networks help coordinate regional services. Local GPs often play a bigger role in rural areas, managing a wide range of health needs. Telehealth has improved access to specialists, reducing the need to travel for every appointment. And when you do need to travel, each state has assistance schemes that can help with the costs of travel and accommodation. Planning makes a big difference. Clustering appointments so you can see multiple professionals in one trip, making sure your team shares reports, and using telehealth for follow-ups where possible all reduce the burden. And carers are particularly important in rural and remote settings. Whether family, friends, or formal carers, they play a huge role in supporting daily life. Supporting carers, making sure they have information and respite, is vital too.
So really, what's the takeaway when you think about all these different health professionals working together?
A care team is dynamic. It's not rigid. It adapts to your needs over time. Sometimes that means involving new specialists. Sometimes it means leaning more on allied health. And sometimes it means using technology to keep everyone aligned. The takeaway is that you don't have to navigate Mito alone. There are systems, supports, and professionals designed to help, even if it takes persistence to connect with them. Your care team will look different to someone else's, and that's okay.
What matters most is that you feel supported, understood, and involved in decisions. And remember, all the resources and references we've drawn on for this episode, including how to find the Mito Professionals Directory, the helpline, and the Mito Clinics listing will be included in the show notes so you can explore further. You've been listening to MitoCast by Mito Foundation. To learn more or find support, visit mito.org.au or call our helpline on 1300977180. Make sure you follow MitoCast wherever you listen to this podcast to help us spread the word by sharing it with others impacted by Mito. Thanks for listening.